Diet and lifestyle are really important when it comes to managing menopausal symptoms and to protecting your long-term health. And I think the number one thing you could do is include more fruits and vegetables in your diet. So some studies suggest that women who have a vegetarian or vegan diet suffer from fewer menopausal symptoms. And we also know that those who follow a plant-based diet have lower rates of heart disease and also cancer. However, if you're not vegetarian or vegan, you can still improve your diet by just making sure there's more fruits and vegetables on your plate anyway. It's also a really good idea to increase things like nuts and seeds in your diet, beans and pulses. And I often recommend soya foods, so like tofu or edamame beans, because they're full of phytoestrogens, which are plant-based estrogens which can help with the symptoms of menopause. In terms of other dietary advice, it's a really good idea to minimise things like processed foods, junk food, so stuff like takeaways, cakes, biscuits, crisps and things like that. And also to be aware that alcohol, caffeine and spicy food can really affect some of the symptoms like hot flushes and sweating. So I know that's important for a lot of you, and alcohol and caffeine are particularly important here. So if you are affected, it would be a good idea to reduce these in your diet or maybe to cut them out altogether. Exercise is really important in managing menopausal symptoms and again for helping with your long-term health. I know that's difficult for some of you, especially if you experience chronic pain, but we'll talk about that in a little bit more detail in a minute. We do know that exercise can help lower the symptoms that you're experiencing, especially with mood-related symptoms, so if anxiety or depression affect you. And in terms of bone health, it's important to do weight-bearing exercise. So that's things like, walking or maybe jogging or dancing. If that's difficult for you, maybe something like yoga or Pilates class would be good because you're also using your body weight in these classes too, and that helps strengthen the bones. It would be really good if you struggle with pain or and have disabilities which are affecting your ability to do certain exercises, to maybe work with a physical therapist or maybe contact the trust who can help advise you regarding this. Sleep is really important in helping to manage menopausal symptoms and also for your long-term health. So I'd try and aim to get at least 7 to 9 hours of good quality sleep. Of course, this can be difficult if you're experiencing symptoms. However, there are things you can do to kind of help, improve your sleep. So trying to have a set bedtime can be enormously helpful, as is trying to get up at the same time each day, and then you get your body into a good rhythm. And the key thing really with sleep is to make sure you're not looking at things like your phone or iPad or computer in the 90 minutes before bed, because the light from the screen kind of tricks our body into thinking it's daylight and then it's harder to go to sleep. Also, another good tip is in the morning to try and get outside and get some morning light within the first 2 hours or so of getting up. And if that's not possible for you, try and have your breakfast or morning drink by a bright window to get some of the morning light. Another thing which is really key during the menopause is managing stress. So obviously we all have stress in our lives just as day-to-day living, and it's probably particularly hard if you've got ongoing health problems like the pain and other things that a lot of you will have going on. But it's very important to find something you can do to minimise that. So whether that's through something like yoga, which we've talked about as well in terms of exercise, that can help with your mind and minimising stress. Maybe there's things like mindfulness, so there's apps out there which you can get on your phone or iPad that can also help your brain switch off. And sometimes it's just as simple as doing something like watching a film that you find relaxing or funny, or having a talk with a good friend, sit down and a cup of tea or something like that. There are some supplements that I think are worth taking during the menopause, mainly really to protect long-term health rather than to help with the symptoms as such. So on top of having a well-balanced diet with lots of fruit and vegetables, I would say that it's worth taking a vitamin B12 supplement, a vitamin D supplement, and considering an omega-3 supplement. So vitamin B12 is very important, especially for our brain and our heart health. And everybody over 50 really should be taking a supplement, as we're not able to absorb it from foods very well anyway. Vitamin D is very important for our bones, and because there's not enough sun where we live in the UK, that's why it's very important to take this vitamin, especially in the winter months, so maybe from October to April. And in the summer, if you're able to get outside and expose some of your skin to some sunlight for at least 20 minutes a day, then that's another way of getting vitamin D. That may not be possible for some of you, in which case it's probably a good idea to take vitamin D all year round. In terms of omega-3 supplements, these are important really for brain health, and they can also help, we think, a little bit with heart health. I'd recommend the algae-based supplements when it comes to omega-3s.